Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. India yesterday reported over 3 lakh cases of COVID-19. This is the highest daily increase in infections the country has recorded so far. In fact, no country has recorded more cases in a single day. And as COVID cases rise, India's health infrastructure continues to crumble under the pressures of the second wave. There are long queues outside hospitals, several crematoriums are overworked, and people's social media timelines are filled with desperate requests for a hospital bed and oxygen. In this episode, we will talk about how Delhi and Uttar Pradesh have been facing these issues. And in the end, we will also talk to Indian Express's bureau chief about how at this time, BJP politicians are being inundated with calls and requests, but are unable to help even their own party workers. We'll start with Delhi first, which is the worst affected city in the country right now. The city has been facing an acute shortage of oxygen for 3 consecutive days. Several hospitals in the city have been raising alarm bells about the situation, and many of them have even been forced to post call-outs on social media, SOS alerts that they have only a few hours of oxygen left for their patients. Some have even approached the High Court for this crisis. Yesterday in an interview with ANI, Sunil Sagar, the CEO of Shanti Mukund Hospital in Delhi, broke down while talking about this crisis. At that time, he said only 2 hours or so of oxygen was left in the hospital.
You see, we as a doctor, we as a hospital, we are supposed to give life. If we cannot give them oxygen even, what is the situation? If a patient comes to a patient will die. Patient will die.
Now, the hospital did get oxygen later, but this is the kind of situation that many find themselves in. And the most frustrating part of this for many is that the reasons for this crisis appears to be administrative and bureaucratic. In this segment, we talk to Aastha Saxena, who's been reporting on this crisis for the Indian Express about the situation in the capital. Aastha, for the past 3 days, hospitals in Delhi have been facing this acute shortage of oxygen. Could you talk about some of these hospitals and what these past few days have been like for them?
Yeah, so for the last 3 days, many hospitals in Delhi have been complaining about the shortage of oxygen supply. When we say oxygen supply, it means the liquid medical oxygen supply, which is transported to the hospital in the centralized form. So hospitals like Max, Apollo, Gangaram, Fortis raised alarm about the depleting oxygen levels on Wednesday. However, the situation was different on Thursday with next line of hospitals. That means relatively smaller hospitals reporting about the unavailability of oxygen on Thursday. So these hospitals have been making panic calls to the authorities, and by authorities we mean here police officials, Delhi government officials, center government officials, and the oxygen suppliers to provide them the oxygen supply at the earliest. Many of them have their patients COVID patients admitted in the hospital, and 80% of them are in the ICU. So when we say that these patients are in the ICU, that means they require high flow oxygen supply, and the hospitals cannot at any cost reduce the oxygen pressure for these patients. So this has been the situation for the last 3 days. These hospitals had been getting calls in the morning from the oxygen suppliers that we will not be able to provide you the oxygen in 1 hour or in 2 hours. And these hospitals are left with no other option but to wait for 7 to 8 hours. And during that time, the life of the patients are at risk because they have to reach out to the other people who will provide them the oxygen cylinders, which only provide a temporary relief.
And what happens in a situation when a hospital essentially runs out of oxygen? What are the choices that the hospital is left with at that point?
So a hospital generally runs on liquid medical oxygen supply, and those patients, and in this situation, they are left with 2 options. Either they will have to discharge those who have better oxygen saturation levels, let's say at 95 or 96, or they will have to transfer the patients admitted in the ICU to other hospitals because they cannot wait for the oxygen suppliers to provide them the oxygen supply, and they can't wait for a longer period of time because these patients admitted in the ICU require continuous and high flow of oxygen.
And what is the reason that these hospitals are not being able to get oxygen that they require?
So, for the last 2 days, the Delhi government has been saying that the tankers carrying oxygen were not able to reach hospitals in the Delhi, in the city, as they were being stalled by police and officials in UP and Haryana. So, even on Thursday, Deputy Chief Minister Manish Sisodia, he wrote a letter to Harshvardhan, our Union Health Minister, informing him about the situation, where he said that police and senior officials of the administration in Uttar Pradesh and Haryana are stalling the tankers that are carrying oxygen, which is leading to a delay for the hospitals in Delhi to get the oxygen supply. So, this is what the government is claiming, and this is what the hospitals have been saying, that the oxygen tankers are not reaching the hospitals on time, which is why there's a delay in getting the oxygen supply.
Right. And Asa, there have also been incidents where hospitals in panic have approached the High Court regarding this crisis. So, what hospitals have done that, and what has the High Court said regarding this matter?
So, by Thursday morning, many of the hospitals were panicking about the depleting oxygen supply. Saroj Super Speciality Hospital in Delhi approached Delhi High Court regarding the oxygen supply, and the court has directed the center to ensure that there is uninterrupted supply of oxygen in Delhi. And another hospital, Sri Balaji Action Hospital, has also approached Delhi High Court, in which they have requested the court to intervene in the matter and ensure that the supply is not interrupted by due to the logistical issues. So the court has guided center and state government to work in coordination and immediately provide the required oxygen supply to the hospitals in Delhi.
And there is also this situation, which I suppose is unprecedented in many ways, that we are finding hospitals putting out requests even on social media, right?
So this has happened for the first time. Like, we are witnessing hospitals reaching out to the ministers and government on social media, requesting them to intervene in the matter. Even on Thursday, one of the hospitals in East Delhi, Shanti Mukund Hospital, they went into a panic mode because they were running out of oxygen supply, and there were 110 patients admitted in the hospital. They were COVID patients. So the hospital by the evening had to discharge 7 patients because they had no other option. The supply was not replenished by that time. However, the tragedy was averted as the authorities swung into action, and after the hospital began sending the patients home. So a green corridor was created by Delhi and UP police, through which the tanker reached the hospital by the evening and the supply was restored. In another incident, the Metro Hospital in Preet Vihar, that hospital has to transfer its patient admitted in the ICU to its other centers because the hospital's oxygen supply was finished and it was not able to restock it. So there has been incidences where the hospitals are now reaching out to the ministries and to the government through social media, asking for help so that the oxygen supply can be refilled.
And next, we talk about Uttar Pradesh. The state right now is the second worst affected by COVID and is struggling to cope with the surge in cases. Yesterday, it recorded its highest case rise with over 34,300 cases and 195 deaths. In this segment, we speak to Avnish Tiwari, who reports on Uttar Pradesh for the paper, about how the state is doing and the measures the government claims it is taking. Avnish, Uttar Pradesh has been one of the worst affected states in the country. Before we talk about how the state has been handling it, could you talk about the kind of cases and deaths that the state has been witnessing during this wave?
Yeah, definitely. So recently, as you said, it's one of the worst affected states in the country. And just 3, 4 days ago, it became the second worst affected state as it crossed 2 lakh numbers in terms of active cases. And the thing is, if we compare this with the previous surge, which was recorded in September last year, this one is way, way, way more worse. That time, at the peak of the surge, we were recording just 7,000 to 7,500 cases per day. Now this has crossed 30,000 cases per day. If we compare this in terms of active cases, the highest number of active cases was just above 67,000. Now we are reaching close to 2.5 lakh. And another important thing is that positivity rate is much, much more higher. That just 2 or 3 days ago, I recorded it was around 14%. Back in September last year, it was just around 3 to 4%. So definitely, we can say that the present surge is much more worse, and this is much more widespread because this is not just limited to 5 or 6 districts across the state. And if I have to give some perspective, just 3, 4 days ago, 7 districts in the state recorded more than 800 cases. 5 districts had more than 500 cases, and 23 other districts had more than 200 cases. So definitely we can say that this is way more worse than the previous surge, and this is going to be worse if we do not contain this in time.
And at this time, what kind of pressure has this put on the hospitals and the healthcare infrastructure of the state?
See, as I was saying, unlike the last surge, this came very suddenly. And if I give you data, on 31st of March, the state had less than 10,000 active cases. And as of now, we are close to 2.5 lakh active cases in just last 22 days. So we can understand how hard it was for the state government and the authorities to prepare an infrastructure. I remember in March last week, I was talking to a very senior health official. Back in February, the number of COVID beds were reduced to just 83 from 6 to 700 beds during the previous surge. And after the cases started rising slowly in the month of March, they increased the number of beds. They notified 45 more hospitals. And back then, when I was talking to the health official, he said that they have around 25,000 COVID beds. And given that no more than one fourth of the patients are symptomatic, they are prepared for around 1 lakh active cases. And casually, that health official said that I think preparing for 1 lakh active cases is more than enough. So you can get an idea that they were saying 1 lakh active cases is more than like preparation for 1 lakh active cases is more than enough. And now we have 2.5 lakh active cases. So definitely there was a toll on the health infrastructure and no one was prepared for this. There is a big question mark on the state government also because this is not the first time the COVID surge. Last year, we had time to prepare for this. We had 2, 3, 4 months to prepare when the cases started declining, but we did not use that time. And that is something which is showing results now.
And do we have a sense of just how many beds are available for COVID patients in the state?
Actually, that's a very interesting thing because for last 4 to 5 days, I have been trying to get an exact number of COVID beds in the state, but the state government is not providing me the same. I remember when during the previous search, every day they were giving the details and data of the COVID beds available, but they are not doing this. And that definitely sounds fishy because there is no reason they will not provide me the data for that. However, if we talk about the on ground situation, it's unimaginable the situation that there is people are not finding oxygen, not finding ventilator beds, and not even normal beds. I went to the biggest health facility in the state, that is the KGMU. People were waiting 2, 3 days for bed, and that was around 10 days ago. The situation with each passing day, the situation is worsening. We as a journalist are getting like 6, 7, 8 calls every day because people think that being a journalist we know who to call, we have contact, we have some influence, but even we are not able to do anything. And not just as a reporter but as a normal human being, this breaks my heart. We are not able to help people. No one is answering because the hospitals do not have beds. People are waiting for days and days. People are dying without oxygen, and it's really bad. It's really bad.
And you mentioned this acute shortage of oxygen, which the state is facing, similar to many other states. What kind of things is the government doing to ramp up oxygen supply?
So definitely they are claiming to do a lot of things. Time to time, Chief Minister Yogi Adityanath, who himself is positive and in isolation, he keeps claiming that there is no shortage of oxygen. And recently, he asked the officials to set up at least 10 oxygen plants in the state. In addition to that, the Sanjay Gandhi Postgraduate Institute in Lucknow, it was a 20,000 liter capacity plant was installed there. And other than that, the CM has asked the authorities to prepare a plan for next 15 days. And if they have any requirement, then they should write it to the center. So they are claiming to do a lot of things. And they have asked the authorities to ensure at least 36 hours of oxygen at every single hospital. But that is not the case because we are calling hospitals and they are saying they have just 4 hours of oxygen, they have 10 hours of oxygen. And let's see once these oxygen plants start running, hopefully things are going to be much better. Let's hope.
Right. And the other thing that seems to be the case is that the official deaths that the state is reporting don't seem to match, what we are seeing in crematoriums in the state. You visited crematoriums and graveyards. What do we gather from those who are working in these places?
So yeah, definitely there is some discrepancy based on what the government data is saying and what we are seeing on the ground. For example, around 1 week ago, I visited the Lucknow crematorium at Bhaisa Kund, and I met the officials there. So during that time, the municipal commissioner wasn't around, and I asked him, "Ki, what has changed in the past few days? What are the numbers you are getting?" So he told me that there is a separate section for COVID bodies, and on for last 2 weeks, that was around 1 week ago. He said for last 2 weeks they are getting around 55 to 60 bodies per day, and that is not even near what the data government is saying. Take an average of the number of deaths reported in Lucknow, it's just close to around 18 to 20 to 25. And if a single crematorium is cremating around 55 to 60 bodies, then definitely that is far from what the government data is saying.
And Avnish, you mentioned the measures that the government is planning to take in terms of oxygen supply. But what measures are in the works when it comes to containing this entire surge and bringing the state to a much better place?
So, as the chief minister has already announced that we are not going for a complete lockdown, and instead we will focus on micro containment. So, what the state is doing that we are making containment zones. If a single person is positive, then around 25 meters is made a containment zone, and if more than one people are there, then it is for 50 meters. And at the same time, a lot of migrants are expected to come back in the state because the states like Delhi are imposing lockdown and people are scared that they will not have any job and they should come back to their native places. And to deal with that, the state is preparing a lot of quarantine centers where those people returning can stay for around 14 days. And if they do not have any symptom or they test negative, they can go back to their houses. Other than that, government is trying to increase the number of beds, even though we do not have an exact number how many beds we have in the state at this point. Government is claiming to be increasing the number of beds. They are declaring other non-COVID hospitals as COVID hospitals so that COVID patients can get treatment over there. The KGMU, which is the biggest facility in the state, that has been completely turned into a dedicated COVID hospital with around 3,000 to 4,000 beds. But at the same time, we have to consider the fact that the number of active cases in the state and number of patients who need oxygen supply or ICU beds or any kind of treatment, that number is increasing with much more high rate in comparison to the number of beds we are able to increase. And that is something which even the state government officials and the health officials are also accepting. But they are saying that they do not have any other option, and that is why if there is a patient admitted to a hospital and the person has stopped showing any symptoms, then immediately without a second test that person will be sent to home isolation. So there are measures the state government is taking, but let's see, we have to wait if those measures are enough in the coming days.
During this time, those in need of a bed or oxygen are trying to get help any way they can. But it's becoming increasingly hard to do that. Now, one thing that usually happens in a crisis is that if you have connections that are political or you know people within the administration, you are usually able to find help. But things have got to a point that even that is not possible anymore. In fact, a lot of people within the BJP are being inundated with requests but are not being able to help anyone, even their own party workers. In this segment, Ravish Tiwari, Indian Express's bureau chief, tells us about the situation that BJP politicians find themselves in right now.
So I've been talking to people across party lines, trying to figure out, as a political worker, how they are finding the situation on the ground. The one thing I noticed, given how the BJP is the largest party and the ruling in a large number of states, so I end up talking to a lot of BJP leaders, MPs, people, those who are office bearers in state BJP, and they're now feeling helpless, even in the states where the party is ruling the state. So I spoke to several BJP leaders in a couple of BJP ruled states, and they were telling about how from morning till late in the night, in fact, even while they're sleeping, they're getting calls, messages about, and they're only talking about three things: is admission with the bed in a hospital, oxygen, and remdesivir. So all these talks about numbers, etc., is not on their mind. The only thing a political worker of the ruling BJP is finding is the three demands. Can you get me a bed in any hospital? Can you get me an oxygen cylinder? Or can you get me a remdesivir medicine, which is used in early stages if you are feeling breathlessness or those kind of things? So it's now gone to such a level that they are not able to arrange it. They are finding it difficult even to accommodate it for their own party workers who are spread across their states. In many cases, one BJP state unit president told me how he got a urgent request for a oxygen cylinder for one of his workers in a remote district, and he took time to arrange it. It was so scarce that, and by the time it could be arranged, that party worker was dead. So it hits them home also. So it's not about some ordinary people requesting a political worker, but even their own worker, those who work during the election for campaigning, etc., are finding it difficult to connect to these supplies, even in the states where the party is ruling.
Okay, so Ravish, the requests, like you mentioned, are related to oxygen, beds, and remdesivir. But how are these current requests different from requests they were getting, say, last year?
So another interesting thing that they pointed out that we have political workers. Our job is to reach out people in times of distress. So there's nothing untoward on people reaching out. So they are not taking it otherwise that people, those who are unknown to them, are reaching out. But they highlighted how the last year when there was lockdown and there was sudden exodus of migrants from cities, major cities, and they were walking barefoot or whatever conveyance they could arrange for, sometime without food, water, or all those kind of things. Those time, these leaders said that they were all active again last year also, and that time it was mostly first was to arranging food and water, which was not an issue. And particularly if they were workers from the ruling party, it was easy to get a ration from the public distribution shops and get them arranged for people in langars or create open kitchens. So that was easy for them. And they had manpower in terms of political workers to meet at least these basic demands and also arrange for transport because there was lockdown. So all the vehicles were lying in their stands. All they had to get a pass from the state administration and arrange for transport from one place to another place. So that was easy for them. So while last year also they felt inundated with these kind of requests or these kind of situations, but this time they are saying that this is something completely beyond their control because these things are scarce in supply and there are not enough. Even the requests are being met a couple of days later, and the severity of infection is so much that many times they lose lives during this period. So the last year was bad. They thought that that was the worst they have already handled. But this year they realized that it's gone much worse and they're feeling helpless. I mean, they're just hoping that situation will improve in terms of supplies of beds or oxygen or the medicines, or even the wave abates a bit.
And you also write that now many within the BJP, now that they are feeling helpless and are being inundated with so many calls and requests and they can't do anything about it, at this time they're looking for some kind of direction from the central leadership. Could you talk about what they have said in that regard?
So, unlike opposition leaders who are free to voice their opinion and expression and criticism of the central government, being the member of the ruling party at the center, they find it difficult to openly express the situation to media or things like that. But privately speaking, they find a difference. The one thing was everybody saying that घबराहट है, लोगों में घबराहट फैल गई है. So some kind of anxiety is spreading across people as the news reports of scarcity spreads and the wave continues as it is. So for that anxiety, they think that their words are not being sufficient because they're not able to meet the requirements. So they're looking at the leadership will send some kind of reassuring commitments. So just look at the numbers, how it happened. The Prime Minister spoke 6 times in his address to nation last year when the peak was 98,000, not even 1 lakh daily cases in September. So during March 24 to September, he spoke 6 times to the nation. This time, the cases went from April first week around 1 lakh to 3 lakh within a fortnight. And during this time, the entire BJP workers were looking for what to say because they were grappling with the scarcity and there was nothing, no how to communicate, what to say, because they don't have a big picture. They are workers at the district level, they are workers at the state level. They are not exactly experts in medicines or community health. And they're just people, those political workers who go and reach out to people in distress. But they don't know how to say that, what to say that, whether they can give an assurance or give a timeline to all these requirements. So they were desperately feeling some guidance to come from the central leadership. That's why one BJP leader, one state unit chief, which I spoke to earlier in the day on Tuesday, rang up quickly when the Prime Minister's office tweeted that the Prime Minister will be speaking, addressing the nation later in the evening. He just called me and saying that Bhagwan ne meri sun li, suggesting that he felt relieved, at least because the Prime Minister will at least give some outline through which they can keep going to the public and reassuring, okay, there is a shortage, but we are trying. Look, this is what the Prime Minister has said. So that is what they were looking for, always a guidance, more guidance as the scarcity persists.
You were listening to Three Things by The Indian Express. Today's show was written and produced by me, Shashank Bhargav, and was edited and mixed by Suresh Pawar. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can tweet us at Express Podcasts and write to us at podcast@indianexpress.com.